Hello, I'm Brian Skinner with InformedEntrepreneur.com. I'm here today with Dr. Jason Jenkins of Jenkins Family Chiropractic. Jason, can you tell us a little bit about your background, how you got started in the chiropractic industry?
Sure. I had always wanted to be a doctor as a kid. It was either play shortstop for the New York Yankees or be the team doctor. I was always involved in athletics.
Yep.
And a guy named Derek Jeter came along, so that kind of limited my options for the New York Yankees. But I had always wanted to go into some sort of sports medicine, and when I was in my undergraduate program and seeing my local chiropractor, he talked to me about the difference between chiropractic and orthopedics. And based on the way I had grown up and having a family that had always attended every athletic event or function that I was involved in, and realizing the life of a surgeon compared to the life of a chiropractor who gets to have quality family time and set hours and still develop a relationship with his or her patients, it just seemed a better route for me personally.
Awesome. How did you get started with Jenkins Family Chiropractic when you got out of college?
When I graduated from chiropractic school, I opened up my own practice right away. I was in Norwalk for the first 2.5 years, renting space from somebody else, building up my practice there, and I was teaching full-time at a community college. And after a couple of years, I just decided that I wanted to be in practice full-time, not teach as much. I still continued to do an adjunct teaching program. But the office here in Milford became available, and this is the town that I had grown up in. So I wasn't happy with the arrangement that I had in Norwalk and decided that I really wanted to be my own office owner, not rent space from somebody else. And when this became available, I moved back up to Milford where I had grown up.
You've been here for how long now?
In April, we're actually coming up on our 10-year anniversary.
Congratulations.
Thank you.
It's a big milestone.
Yeah.
I know traditionally, I used to think that chiropractic was more something you would seek after you got in a car accident or you had some kind of stinging back pain. But from talking with you, I know that's not the case.
Right.
Can you share us a little bit more about what exactly chiropractic is?
Absolutely. You know, that is a common misconception, that people are under the impression that they need to have had a auto accident or a traumatic event to their neck or to their back in order to see a chiropractor, when in fact pain and neck issues and back injuries are really such a small percentage of what we do, and has nothing to do with what chiropractic actually is. Chiropractic is really about the maintenance of your nerve system and the flow of the body's electrical impulses through the spinal column to every cell, tissue, and organ, showing those tissues the actions that they need to carry out. So I wouldn't be able to wave my hand if my brain didn't send an impulse through my spinal cord and down my arms. We all think of Christopher Reeve as a perfect example, who had been thrown from a horse, injured his neck, and nothing below the vertebra that he fractured would work. Now the interesting thing about that is his heart still beat, his lungs still functioned, his liver, his kidneys, and the reason for that is those nerves are those organs are controlled by nerves that come out of the top 2 vertebrae. And so in our office, the most important thing that we can do for patients is maintain a structural alignment and integrity of the spine that allows those nerve impulses to travel freely to every cell, tissue, and organ, the most important being the top 2. And so in our practice, while we do take care of people with injuries and after car accidents and spinal pain, it's really a small percentage. The majority of our practice is centered around spinal function, coordinating total body function, and ultimately the top 2 vertebrae. So I'm what you would consider an upper cervical focused chiropractor.
Over the last 4 or 5 years, the topic that's really dominated the news is healthcare reform, where it's going to look like in the future, how we're going to pay for it. Can you share with us a little bit more about how you feel about this entire topic in general?
Yeah, I think that we first have to start at calling a spade, and what our national government is doing in calling something healthcare is calling something healthcare that is really insurance care and sick treatment. They're talking about revamping health care when the process and the services that what we render and cover in the United States under insurance is nothing to do with health. It has to do with sick treatment. The United States ranks 48th in the world in the health of its population.
Yep.
And when we talk about revamping healthcare, we're not talking about changing the way health is delivered. We're talking about what's covered. So they're not really talking about health care delivery system and changing health care. They're talking about insurance coverage for the treatment of the sick and injured. Where the United States really thrives is in crisis care. So if somebody gets shot, if somebody gets injured where they break a leg, break an arm, they have a heart attack or a stroke, God forbid, emergency room care, crisis intervention. The United States ranks #1 when it comes to that type of intervention.
Yep.
But if you just want general health, if you want to maintain a healthy body, you want normal blood pressure, normal cholesterol, no headaches, proper sleep, proper mental health, anxiety, depression. The system that we have is a system of managing those conditions through the use of dangerous medications with a lot of different side effects. And I don't know anybody who started on an antidepressant that the antidepressant got them better and they didn't need it anymore. Or somebody who started on high blood pressure meds and they didn't need those medication anymore because the medication made them better. And what we need to realize is that's not the intention of our society in medicine. The intention is really to manage the condition, and that really has nothing to do with health. One of the sayings that I frequently will utilize with my patients to get them to realize this is that if medications made us healthy, then the person taking the most meds would be the healthiest.
Yeah.
And they're not, they're the sickest. And so what we have to realize is that the system that's being put in place is the improper system.
I agree. As far as your patient and your practice development goes, how do you find or help most of your patients? How do they come to you?
Most of our patients will come to us based on referral of other patients. We don't do any advertising. I do quite a bit of outreach programs when it comes to lectures in a PTA or lectures at local businesses, lunch and learn type sessions. And I get out there and I teach how your body actually works and how to maintain a healthy body before you lose it. What we're trying to teach people is that there are two reasons why somebody would see a chiropractor. Either because they have spinal problems that need to be corrected, or they don't and they don't want to develop them. It's the same model that somebody would use for a dentist.
Yeah.
And so rather than advertising injuries and headaches and things along those lines, it's our patients who refer their friends and their family members because of the results that they've seen under care. And secondly, when I go out and I do lectures and outreach programs.
Yeah, I think that's a really good idea. I'm fairly educated, and I don't live under a rock, but I had a complete misconception of what chiropractic was, why I should be coming in on a monthly basis, those types of things, just the basic ideas and principles behind it. It took me coming in and talking to you to really understand the benefits of it and why I should be doing it. And
that's not uncommon.
Yeah.
We see that in a lot of people. We are not educated in society as to how our body works. The basic principle of chiropractic is that the body is a self-healing and self-regulating organism. And if we've lost that ability to self-heal and self-regulate, it's because something's interfering with that. What we look for as chiropractors is called a subluxation that would be interfering with the brain's ability to communicate with the body through its nerve system. So my job is simple, and it's simply to correct that subluxation when I find it. And then we get out of the way and we let your body's own natural innate healing potential do what it needs to do. And that's really the big difference between medicine and chiropractic. Medicine looks to do an outside-in intervention and give you something because your body is weak.
Yep.
Chiropractic says the opposite. Your body's strong and has everything that it needs. The difference is something's interfering with its ability to regain health. I'm going to identify that interference and remove it.
It's like when I get a cut on my arm and my body heals the cut over time.
Exactly. And it does that whether you take a medication, whether you put Neosporin on it, a Band-Aid, or you leave it alone. The health didn't come from the Band-Aid or the Neosporin, it came from your own body.
Understood.
Yeah.
If someone wanted to come in and talk to you more about what chiropractic is, or they thought they had an issue they'd like you to help them with, what would be the best way for them to reach you?
The best way would simply to be to give Michelle, our front desk manager, a call at 203-877-4198. They can find us on the web at www.jenkinsfamilychiro.com. We have a Facebook page at Jenkins Chiropractic Milford CT, and we're located at 97 Gulf Street in Milford, and we have most of our patients who just walk in and say, I'd like to see the chiropractor, can I have an appointment set up? And we usually take them right at that time. We have our schedule set where we can work somebody into the schedule.
Awesome. I really appreciate you taking the time to talk to us.
Thank you. I appreciate you coming.
I'm Brian with InformedEntrepreneur.com. I just want to thank Dr. Jason Jenkins for speaking with us today.